Hi, good morning. My name is Dr. Janet Davis. I'm here with the Southern Evangelical Seminary. I'm on the Board of Trustees and a student currently looking to get a PhD in philosophy. I'm a medical doctor. I graduated from medical school in 1986 and specialized in obstetrics and gynecology. After I did the OBGYN residency, I went on to do a fellowship in maternal fetal medicine, also called perinatology. That means I specialize in high-risk pregnancies, so I take care of a lot of pregnancy complications. One of the things I do is ultrasounds, and I look for fetal anomalies, meaning problems with the baby. And some of these are lethal, meaning that the babies can't survive without a certain amount of medical support. When I was training in obstetrics and gynecology, I thought I was a Christian, but in retrospect, I was not. I was not saved because I hadn't given my life to Jesus. And our larger association, ACOG, the American College of Obstetrics and Gynecology, is not what you would call pro-life. I was fortunate that I was able to get through my training without having to do abortions, but I did drink the Kool-Aid. They trained us that abortions are a necessary part of health care, that women that are not given access to abortions do unfortunate things that are a lot of times not good for their health to try to induce abortions, and that it was necessary for us to support the abortion industry so that it was safer. That's how we were trained. Later on, when I did my training in maternal fetal medicine, one of the things we did was look for anomalies on ultrasound, meaning babies that had birth defects. And one of the main drives for that was so that the women could have an abortion if they had a baby that wasn't perfect. And I did that for years. I thought of it as a seek and destroy mission. We were looking for abnormal babies, so those pregnancies could be terminated. In retrospect, now that I am a follower of Jesus and believe in the sanctity of life, it was horrifying to me that we would dehumanize these poor babies, that they were children of God like me, and we made them somehow not human. In my mind, I thought Down syndrome babies were experiments of nature. They weren't really human. My neighbor had a child with Down syndrome who was very high level functioning. And even me as a trained maternal fetal medicine specialist, I had to look at her real close to see, does she have Down syndrome? And then I could tell when I got closer to her, but this child was mainstreamed through high school and she audited college classes and later on was working and a productive member of society. And it made me question a lot of my preconceived notions of what Down syndrome children were. I hired a genetic counselor also before I was saved, and she was telling me about going to conferences, and Down syndrome children were giving talks, and they were college graduates and speaking. And I did start questioning, even, like I said, before I was saved. It kind of hit home to me when I was pregnant myself with a high-risk pregnancy. I had twins. I was 43. And statistically, my risk of one or both of my children having Down syndrome was 1 in 15. My husband at that time was very pro-abortion, and he demanded that I have an abortion if one of them had Down syndrome. And that really gave me pause. I'm like, I'm going to kill a normal child just because the co-twin has Down syndrome? I don't know if I could do that. And I had testing, which, praise God, my children did not have Down syndrome, but that really started me thinking that, what am I doing here? After that time, I had a patient that had a child with Down syndrome that wanted me to terminate the pregnancy. And I was doing that at the time. I was doing pregnancy terminations on women with babies with anomalies. And the termination was not going well. I tried to induce labor, and the labor did not get induced. She did not give birth. And I was at the end of my rope, and I'm like, look, we can just stop this, and you can go on home and, let nature take its course. Or I can do a surgical procedure called a D&E dilation and evacuation, which is a horrible procedure. The patient and her husband both quickly said, we want the D&E. We want to get this over with, because we'd been trying to induce her for 2 or 3 days at that point. So I took her to the operating room because I was committed. I felt like I was committed at that point, that it would be hypocritical to stop. And when we were doing the procedure, my stomach was turning. I was very distressed. This procedure involves taking instruments, opening up the woman's cervix, and reaching in and grabbing parts of the baby, just grabbing the pieces and ripping the child apart, basically, and pulling them out. And what they teach us to do is to lay them out on a metal tray. And you have to put the baby back together again to make sure you didn't miss anything. Because if you left any parts behind, that would be a risk factor for infection or bleeding or perforating the uterus complications. So I'm sitting there and I'm piecemealing the baby back together like a jigsaw puzzle. And I'm looking at the pieces, and there's like a perfect little hand and a little foot, and it's like a part of the face because I ripped the face in half. And I was appalled. What have I done? What have I just done? I have murdered this little girl who could have had a life like my neighbor's daughter and gone to high school and got a job and got married. And I'm like, I can't do this anymore. And I may be a hypocrite diagnosing fetal anomalies and not helping the mom in the pregnancy, but I cannot. So a few years after that, I had a come to Jesus moment that I realized my life was not going well. I was at the bottom of my rope, the end of my rope. And I told Jesus, this is it. They say you have a perfect plan for me. Clearly my plan is not working. My life is not going well. I said, I'm yours. Whatever you want me to do, whatever path you want me to walk, I'm yours. In retrospect, one of the things that was holding me back from committing my life to Jesus was I knew I would be all in once I gave my life to Jesus and do anything he called me to do. And one of my biggest worries was he would send me to Africa to deliver babies in the bush. And I didn't want to go to Africa. I didn't want to leave my children behind. And that's amusing now because I did go on a mission trip to Africa last year. And I was telling the leader of the trip this story that I was afraid to give my life to Jesus because he would send me to Africa. And she said, Janet, I think this is so funny. You're telling me this story and we're in Africa. And I said, yeah. And it was an amazing experience. So my second birthday is January 25th, 2014. Shortly after that, I met my current husband, who was a student at Southern Evangelical Seminary and an apologist. And he introduced me to apologetics and SES. And I would never have believed 20 years ago that I would be here, that I would be a student at SES and on the board of trustees and speaking about my life's history. He brought me to the first apologetics conference in 2019, where I met Pastor Stephen Cutchins, who is the one that invited me to be on the board of trustees. And I met Dr. Richard Howe, who was the one that encouraged me to go to school and get my PhD, which hopefully I will before I'm 80. And my life has been totally different. I love contributing to SES, and I love furthering the cause of apologetics. I think SES is so important, and what we're learning in apologetics has the potential to change our country, the trajectory of our country. After I was saved, I became pro-life, and I had the opportunity to help out a woman who had a child with what a lot of people considered a lethal anomaly. Her child had kidneys that were not functioning. And that's a problem for an unborn baby because your kidneys are very important in your amniotic fluid, which is very important for developing of the lungs. And there's a semi-experimental procedure that high-risk obstetricians can do to put fluid back into the womb so that the baby's lungs will develop. And it works sometimes, maybe half the time, that the child will be born and the lungs will be developed. So this was a Christian couple. It was their first child. And they felt a strong pull from God to be parents, even though their child was going to have problems. She actually went to 2 other high-risk obstetricians who told her to have an abortion, that her child's chance was less than 1%. But she found me, thanks to God, through an amazing coincidence. And I did the procedures on her. And long story short, her child is 7 years old now, was on dialysis for 3 years, got her father's kidney. She's in 2nd grade. She was in a beauty pageant last year. And the mom was so excited about her child surviving that she put it all over social media and internet and had a blog for kidney moms. And women started coming to me from all over the country because most people in my line of work think this procedure is unethical because they're in the business of seek and destroy, terminating the pregnancies that are not perfect. And saving a child's life is antithetical to everything I was trained to do. And the high-risk obstetricians at the medical school in my town started generating procedure to get my privileges terminated. And I almost lost my license to practice medicine. Fortunately, the pediatric nephrologist warned me that this was coming down the pike, and I was able to resign my privileges and not lose my practice. I did speak to another maternal fetal medicine doctor that was doing the same procedure as me, and his license was suspended because the doctors in his town complained to the medical board saying that he was doing unethical procedures. And I asked the physicians there, why is this unethical? I'm saving a child's life. I'm a maternal fetal medicine specialist. And their response was, this child won't have a quality of life. She'll have medical procedures. She'll have to go through dialysis. And they couldn't explain to me why that was a bad thing, that a child was going to have medical procedures. I'm like, don't we do this all the time? Don't we do dialysis on a routine basis? Why is it so bad that I'm saving this child's life so that she can have a fairly routine medical procedure? And they couldn't answer me. Since I started as a student at Southern Evangelical Seminary and started studying apologetics, I've had several conversations with other OBGYN doctors about abortion. And I've talked to the ones that drank the Kool-Aid and feel like that abortion is a necessary part of medical care. And especially after the Dobbs decision. And I asked them, what is the fetus? Is it a human being? And most of them can't answer me. But I like to think that thanks to my apologetics training, I put that thought in their head. What is the fetus? If it's a human being? And I think embryology is clear that it is a human being. Is it good to kill innocent human beings? And I think I made a few of them think. I had a long discussion with one of my medical students. I train medical students. It's part of what I do. And she was arguing with me about how abortion was so necessary. And I said, when is it necessary to kill an innocent human being? I hear all these statements in the press, in the media, about how, for instance, the Georgia law, since I practice in Georgia, how the heartbeat law is preventing women from getting necessary medical care. And I'm infuriated by that because that's just a lie. It is not true. There is no law in this country that is going to prevent an OBGYN doctor from practicing on a woman that needs care. If a woman is miscarrying a baby and is bleeding to death, there's no law that's going to prevent me from saving her life. There's no emergency room doctor or OBGYN that's going to hesitate taking care of a ruptured ectopic pregnancy for a woman that's bleeding to death. And I only hope that with my apologetics training with SCS that I'll be able to interact more with these individuals that feel this way. Thanks for listening to my story, and I hope that you partner with me with Southern Evangelical Seminary in our fundraising so that you help support us in our fight to bring truth to the country.